When Telangana state was carved out in 2014, the state has been granted an AIIMS hospital, which has normally have modern medical facilities. So AIIMS Bibinagar has commenced from off late. AIIMS Bibinagar started providing medical facilities to general public, and especially in the wake of second wave COVID, the hospital has scaled up its facilities and started providing exclusive COVID treatment also. Let us speak to AIIMS Bibinagar Director Dr. Vikas Bhatia. Namaskar, Dr. Vikas Bhatia.
Namaskaram. Thank you very much for inviting me.
Let us know, sir, what all the facilities we are having AIIMS Bibinagar at present, and what type of medical facilities you are offering to COVID patients.
I came here 1 year back, exactly in the month of May, and I was at AIIMS Bhubaneswar, where we started the new AIIMS in 2012 during the lockdown. That time was a lockdown period, and this May also we had the lockdown. So in COVID time, when I came here, my main focus was at how to start the new organization, new institution, where people have a lot of expectations. And as you know that there is one building which was existing for many years. So people were looking forward to beginning of a hospital. So we have at this moment in 1 year, what we could do is now we have the best of the faculty in the country in 19 departments from various specialties. Excellent, most talented doctors we have, professors and different positions. We also recruited the nursing officers. They all are permanent. So at the moment we have 80. They all joined in the recent time. That's only in this month of April, last few days. Many of them are still joining. So we issued the appointment letter to 139 who were recruited through a common entrance exam by AIIMS New Delhi. We have a very good strength of the talented and skilled doctors and nurses. We were looking at how we can start with the indoor services. In fact, we started the outdoor in the month of June itself on the Telangana Formation Day, an auspicious day. That's the 2nd June last year, 2020, within a few days of my joining. So very few doctors were there, 5-6 doctors. But now we have, specialties, all the broad specialties. They are offering the OPD services. We have a good lab, and at this time we were, looking at in the middle of April, we found the resurgence and the second wave which came up. We thought that there is a need to respond and help the people. So we opened our C block, which was like closed for many years, cleaned it up, put some beds there. So at the moment we have 50 beds. Half of them have the oxygen support. That became operational on 29th of April. Our doctors and nurses, they have been staying in the hospital, and we have all the facilities, except that we are not able to have the ICU because we need to have oxygen, which is a high demand. And to make that operational needs some extra effort. That work is also going on. So these are the facilities. In addition, we also have the teaching program for the students. MBBS second batch has come. The third batch will also come now. And we have also started in thinking in terms of starting the MD program maybe next year. So this is what we have at the moment.
As far as medical facilities are concerned, as you rightly said, already you have started 50 beds and half of them are with facility of oxygen supply. So what type of patients you are taking in, and what kind of treatment they are being given?
We are admitting patients. Most of them are from the neighboring areas. Even some of them even come from far off places. And now we are not taking any charges. There is no fee, and it's totally free of cost, and we are giving them food also. Patient with symptoms and whose oxygen saturation point is going down from below 94 and who needs some oxygen, or maybe some people who have some breathing difficulty, we are admitting them. So we keep monitoring, we put them oxygen, and we have the oxygen concentrators also. So far we have treated about 70 patients, and some of them, we have got 2 small ventilators also. We had to put them also on the ventilator, which we got last few months back. So we are able to save some lives here. So our doctors, they are providing, and we also have the remdesivir, which you know that has been in great demand, and there were a lot of shortage. We got it from the government of India, 3,000 injections. We are also giving medicines to them, and wherever it is needed in the moderate cases or whatever doctors decide as per the protocol. So they are also being given those injections in addition to the other medicines.
And what about OPD services for COVID patients, sir? Are you offering them?
Yeah, our OPD is also going on, which we started last year. We have not stopped it. But what happens is the routine patients automatically, they feel a little scared to come to the, OPD, and they feel that if they can postpone it, by themselves are not coming. But our doctors are there. We are running that OPD. Additionally, we also started with the teleconsultation. There are dedicated lines which are available, and those numbers are available on the website. We also started the e-Sanjeevani program, where anyone can contact. It's like a video consultation. So these services are available. Anyone can contact in Telangana or consultation from any part of the country. These facilities are also existing. Doctors are coming. So additionally, we also started with in March only, on 26th March, we started with the RT-PCR testing. So that's a big sport to the people here. Earlier on, the samples were being taken and they were being sent elsewhere. So now we have the ICMR approved RT-PCR testing in addition to the rapid antigen testing facility, which is existing for quite some time. Nearly 150 to 200 investigation or tests are being done for the patients every day.
How much is the positivity rate, sir, as far as your RT-PCR testing is concerned?
I was looking in general, the overall in the last couple of months, how this has gone up, or what is the. So it's been like, because what happens is in the hospital, patients come to the hospital who have some symptoms. So this positivity may not be able to give you the exact situation in the community. Still, we are finding between 15 to 20% of the tests are positive. Yet, you cannot make it generalized, because sometimes in your family, somebody has got a disease or symptoms. All members are tested, so automatically they are also likely to be positive. We find that, say, out of 200, nearly 40
cases are being tested positive. You may be aware that the central government is distributing medical equipment which is receiving from other countries and also from its own resources, centralized resources, to several hospitals in states and union territories. So any equipment, especially this oxygen supply plants, have been sanctioned to AIIMS Bibinagar, sir?
We have been sanctioned one PSA plant. We have also requested to them, and we talked to the Ministry of Health and Family Welfare. They will provide one PSA plant to us. Additionally, we have also talked to some people in this region. So they have also committed that they will support us. I hope that, but to make this functional, it takes some time. But the good thing is that now we will be self-sufficient in the near future, in the upcoming days. And even if the corona comes in future or it doesn't come, these oxygen plants are going to be making us self-sufficient in managing the patients in future in general also.
As far as other medical supplies, like just now you mentioned remdesivir and other oxygen supplies, till now the plant is yet to be set up. What kind of supplies you are receiving? Are they sufficient and to address the needs currently?
As the foreign assistance started pouring in from different parts of the world, so whatever the countries were giving, so Government of India starting distributing to various institutions, central institutions in the beginning. So we got a few days back, like about 2 weeks back, the 3,000 I mentioned, the injection remdesivir, and we got 40 BiPAP machines which help in improving the breathing in the patients. We got 1 lakh masks, 5,000 N95 masks, and then 10 days back we got 50 big filled oxygen cylinders. That's really helpful to us. That's very helpful to us. Yesterday we got 8,000 goggles, 8,000 PPE kits, and 8,000 gloves, and another supply of 28,000 of N95 masks. What we got in last few days, and it is still coming. We have also requested government to provide us with some more ventilators, like 25, and oxygen concentrators. We have asked for about 80, and pulse oximeters about 100. So we hope that these will also be supplied us. And fortunately, just before the resurgence of this, we were having 5 small ventilators which we have put into the use, and also the 10 oxygen concentrators. We started using them, so the patients have been admitted. This facility is available for them. So I'm thankful to the Government of India that they came extended this sport well in time. We were having 25 beds in the beginning. Very soon we increased it to 50. We have a plan as we get more supplies and more equipment, wish to increase. I want to increase it to 100 beds immediately. Looking at it, This is what we can do. And we hope that the situation improves, critical situation of the, very high number of cases. We hope that it will come down in next couple of days. But we should always be prepared for future as well.
Any action plan is there, sir, to scale up the bed position or the facilities at the hospital?
Yeah, now that actually the master plan for development of the AIIMS has been approved by the government. AIIMS, Bibinagar, there are different phases. So many AIIMS are coming up. So we are in the phase 7, like we are towards the, towards the end of the phases, phase 8. And so the one which already have been in the process, that is going on. Our master plan is approved, and I'm hoping very soon the tender will be out by the government of India. The construction work is expected to begin. So a lot of new complexes and buildings and medical college and including this building also will be renovated. Because this is partially built. So only 2 floors are ready. Things will come up, will expand, but within the existing infrastructure, we plan to increase our strength of beds to 200. We see if we can also start the ICU very soon. The possibility will explore it, the possibility of starting we have 2 or 3 operation theaters. We have surgeons with us, so we should be able to make operational as well. This is what I'm thinking to have in this year, 2021.
Could you please give your appeal to our listeners, sir, especially those who are living in surrounding districts, and please tell them about your helpline details and what type of services they can expect from you immediately during this COVID second wave.
I appeal to all my fellow citizens, everyone in the neighborhood or in the far off places. First is to please take care of yourself, your family, your neighborhood, your friends, and follow all the appropriate behavior practices such as masks. Very, very important at this stage, even if you have been vaccinated. You come to the hospital in case you have the symptom, you can come forward and get yourself tested based on your symptoms, and if it is needed, whether you need to isolate yourself if it is positive at your home, or you may be advised to be admitted in the hospital, so depending upon the clinical judgment by the doctors. I also appeal to all of you that AIIMS Bibinagar is having excellent facility for the vaccination. We have been providing this facility to general public, and as the supplies further increase and more vaccines will be provided, I'll request we are open to, if we get enough supply, we can vaccinate up to 1,000, 2,000 people in a day. Please come forward. We have excellent facility of testing, vaccination, OPD, and admissions. So all this will be helpful to you. We want to help you, and at the same time, I appeal to all of you to follow all the guidelines which are issued by Government of India and the Government of Telangana, and don't go to the crowded places, and take care of yourself, and this difficult time will be over, and we hope that we'll have a brighter and future, healthier days in near future. That's what I can say to all my friends and my citizens, and to all the community members all around me.
Thank you, Dr. Vikas Bhatia ji. Though AIIMS Bibinagar is in its formative stage right now, elaborate arrangements have been made to address the needs of COVID patients. And as you rightly said, very soon the bed capacity will be scaled up to 200. And as you just now mentioned, we hope the ICU facilities and other modern medical facilities will be available very soon. Thank you so much for sharing information with us.
Thank you very much.